Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And every once in a while, we talk about things that are not what I would say just medically related. However, this is in a way medically related, and we will talk about it. We're going to talk about the SOS Children Villages of Florida. And first I want to talk to Jillian Smath, who is a executive director of SOS Villages of Florida. Welcome.
Thank you.
Good to have you here.
Thanks for having us.
And I know what MSW is, but you tell the people what MSW is.
It's a Masters of Social Work.
That's what I thought. Okay. And Sarah Thomas. Sarah Thomas is an SOS alumna. Then I know you're very proud of that.
Yep.
And she graduated with her MBA and works in the healthcare industry. And I got to say, Sarah, that we're very proud of you, not only because as alumni of SOS, but you're an alumni of Nova Southeastern University.
That is correct.
And you are a shark.
I'm a shark.
There you go. Okay, if I'm going to start with, may I call you Jillian?
Of course.
Jillian Smath, who, like I said, is the executive director of SOS. Tell us what SOS is.
SOS is a residential foster care community. We are located in Coconut Creek, and we have 13 homes around a cul-de-sac, and we are providing care to children that are in the foster care system, primarily from Broward County.
Right. And up when you say in Coconut Creek, where in Coconut Creek?
So we sit just south of the Sawgrass off of Lyons Road.
That's what I thought.
And it's a beautiful middle-class neighborhood. Really, our intention is to provide the kids with an environment that they can be proud of and feel good about, a safe environment. And one of the main things that we do at SOS is focus on keeping sibling groups together.
Well, you know, before I go much further, I want to offer my congratulations and my thanks to the governmental authorities in Coconut Creek. Having the opportunity to have that neighborly environment, I think adds a lot to your presentation of service.
It does. And we appreciate the city because they donated the land for us to actually build the houses on, and also the county, because part of it is Broward County property as well.
So I appreciate the county doing it as well. So, Sarah Thomas, tell us about you.
Oh, well, my journey actually started in foster care. I started at a shelter, and the state was trying to find a permanent placement for me. And at that time, they ended up putting me at SOS Children Village to age out at the age of 18. And
which shelter did you come out of?
My shelter began at Kids in Distress.
Kids in Distress.
Kids in Distress. My journey in foster care began there.
Okay. Well, Kids in Distress is an interesting thing. We have a very interesting relationship with Kids in Distress. We provide dental care and optometry care up at Kids in Distress, and we're very proud of our affiliation and association with Kids in Distress. And just tell me, so then you went on and you started your education career.
Yes.
And you ended up here at Nova Southeastern University, and you worked and you got your MBA from the Heisinger School of Entrepreneurship.
That is correct. That is correct. Actually, I began my journey at Kids in Distress, and then around the time of beginning my journey at Kids in Distress, I ended up meeting Jillian. She was my social worker, and she was with the Department of Children and Families at that time, HRS, and she was placed with me to assist myself and younger siblings to find permanent shelter for us. And so I could just remember Jillian coming in her little red car. She was fresh out of college. I was like 7 or 8 years old at that time. And we ended up clicking, and she'd been with me through my whole entire journey. And then if it wasn't for her and a couple of other individuals that I hold very dear to my heart, Nova, thinking of college may have not been possible. So I give her a lot of credit, and Barbara Zimmerman and Mark Solomon, because without them instilling education in me, probably would never have made it to Nova.
No, that's great. And you're working in the healthcare industry now, so where are you working?
I work for Memorial Healthcare Systems. I'm a reimbursement specialist in the specialty pharmacy.
Oh, in the specialty pharmacy.
Yes.
Well, that's interesting. You know, I don't know whether you know it, but it's been a long time. My first profession was pharmacy. Did you know that?
No.
Yes,
not at
my
all.
first profession was pharmacy. In fact, there's still a couple of the pharmacies that I guess I was involved in is still out there. There's one sitting right on Sheridan Street, right opposite the outpatient Memorial
Yes.
Center called Post Haste Pharmacy.
Yes.
I
Yes.
was involved in building that store in 1969. So you know how old I am. Anyway, so Jillian, tell me again, give me the, what I would say the community discussion of SOS. Tell us about it.
Okay, so I'm going to go back a little bit too, because Sarah's being a little bit modest, but Sarah and I both came to SOS basically together because, as she mentioned, at the time I was working for the state and in the foster care system as a caseworker. I had a humongous caseload of children I was responsible for, of which Sarah was one. And she needed a permanent placement. I was new to Broward County, had never heard of SOS. So I brought her out for her interview, took her through the interview process. At that time, she was accepted, and I got her placed at SOS. And as I learned about who the agency was, I realized that that's where I wanted to be as a social worker. Working for the state was quite challenging. I had a caseload of close to 90 children that I was responsible for, and I didn't feel like I was making a difference in their lives. I wasn't doing quality work. I wasn't, really doing much than popping in and seeing a kid once a month. So as I learned about SOS, and after I got Sarah placed in, I think it was about February, I decided that that was where I wanted to work because it was such a wonderful organization offering so much supportive services and really trying to impact lives and make a difference. So I then, back then, you read the paper because there were classifieds, and they were looking for a case manager. So I submitted my resume, and I was fortunate enough in August of that year to be asked to come on as a case manager for SOS. That's where I started my journey about 21 years ago. And really, SOS is a very unique agency because at the end of the day, the only thing we're concerned about is impacting the lives of children in a positive way. And that can mean many different things for many different children. And I think that's one of the unique things about SOS is that each individual child is looked at as an individual child. So whatever their needs are, we have caseworkers on staff, we have a therapist on staff. When kids come to us from the foster care after being taken away from their parents, each child is evaluated and they're looked at as a whole child, from the trauma that they experienced to academics, to therapeutic needs, socialization needs, and then we set up a plan for that child to make sure that everything that they need is implemented for them. And services, school situations, all of those things are tracked and monitored. Sarah was one that grew up with us, and unfortunately, both of her biological parents passed away, and she didn't have a chance to be reunified. So she grew up and lived at SOS for 14 years.
Yes.
But some of the kids that come to us have biological families that they do visit with, and that the families seek help for themselves, and the kids are able to then go home. So really, we offer, an array of services that are individualized to each child and family.
Well, that's the way it should be. I'm so proud to know that you're sitting there.
Thank you, thank you. I think a lot of it has to do with just SOS model of just looking at a child as an individual. I could just recall when I was a teacher, because I taught for Broward County School for several years as a classroom teacher. And being a teacher, you can't look at your whole class as one whole. You have to look at the individual student. You have to look at what their needs are and how to arise them to the occasion and to be successful as they move on to the next grade. So I think SOS with that model of looking at a child as an individual is so, so important. I never recall being at SOS and I was never held accountable for anything. that they held me accountable for good things, and they held me accountable for bad choices. So with that being said, I think Jillian and many of the other staff that she has under her, they just hold everyone accountable, including the staff, including the ones who have to work with the kids. So you can't look at each child that's coming into foster care as, oh, this is another kid in foster care. Well, no, that's an individual child. What do that child need once they leave us at the age of 18? Because once you turn 18, the state basically cuts you off. I've also sat as a board member with ChildNet for several years, and ChildNet's a community-based agency that works very closely with a lot of kids in foster care. So I was the big voice at that table because I brought my experiences, I brought my knowledge of what I think kids will need to be successful. And I think it's just so important when you have those open discussion. And mental health is something that I think all of us at some point in life, I don't care if you're in foster care, if you raised with a single mom, single dad, a big family, but mental health is a thing that we all need to be aware of. And just going into foster care, that's a big mental health. It brings on a lot of different adversities, but what you said, just, being held accountable and knowing that I have individuals when I was living at SOS that made me realize that the cards are stacked against you and you have all these cards dealt in front of you. How are you going to play your cards? What do you want out of this life? Because this is not a permanent situation. This is just a temporary situation. So for me to look at my situation coming into foster care, losing my biological mother at a very young age, and shortly after that, losing my father, I knew I was familyless in a sense, but I do have a family, and SOS is my family. I don't know how many times I called Jillian. It could be like 2, 3 o'clock in the morning. I'm calling her if I have a dying situation, just like any child will call their mom or dad if they're in a situation and they need mom and dad to come and assist them. So just being able to know that I have that as a pillow and that support system, it's really great. And the more we have the conversation of foster care still exists, kids are still being put in a system every day, these kids need assistance, they need help. The more we have that conversation, the more we can identify situations early on with kids and provide them with the resources and the tools to be successful. And I think that's what made me as successful as I am.
Well, how do you feel about that?
It's great. And one of the things that's unique to SOS is we have a secondary program, and that's called Next Steps. So as Sarah mentioned, typically at 18, children are exiting the foster care system. They're called young adults, but for all intents and purposes, they're still kids. And about 18 years ago, as an organization, we recognized that the young adults were not ready to be on their own. So we created this program. We have 3 staff members solely designated to this program. And basically what they do is help the young adults make the transition from SOS and the foster care system out into the big world, and make sure that they continue to have the support and the resources necessary as they start facing the world to get through the challenges that we know are presented to them each and every day so that they can be successful adults. And we have about 85 young adults in that program today, and they are in their own apartments, they're living in college dorms, they're very successful. We are really proud of our statistics because in foster care, typically children graduate high school at a rate of about 50%. And at SOS for the past 15 years, we've had 100% of our kids that are supposed to graduate from high school actually graduate, and 100% of them are going on to some form of secondary education, as we saw with Sarah attending NSU. So that's key to their success because we know without education, it's pretty challenging in this world. So we have that program to make sure as they begin to enter these schools and into careers that they have people that they can turn to at any time to help them with whatever it is that crosses their path that day. And sometimes they fall down. You know, plenty of times we get calls from our young adults saying, I can't pay my electric bill this month. Can you help us? And that's what we do, because that's what parents would do, right, for their kids. And for us, we've invested so much having the kids live with us before the age of 18 that the last thing we want to do is just turn them out on their own and say, figure it out. We want to make sure that we offer them whatever it is that they need to get through that next stage so that they can really be successful. And we've got great examples of that success. You know, Sarah's got her MBA. We have a gentleman that's a detective for Broward Sheriff's Office. We have a bunch of social workers, a bunch of teachers. We have a young man who works for Pulte Homes, and he just got promoted to a supervisor position. So those stories tell us that what we're doing is right and really is making a difference.
There are areas of this nation where, you know, children are just left to the streets, and it's sad. So we are really blessed by having something called SOS in our community. And I very rarely do this, but I'm going to do it now. What is the address, or how can people, if they want to
Get involved?
Support you, I'm not going to just say get involved. You know, they may want to write they may want to write a little check. Well, how do they get it? What do they send it to?
Well, the easiest thing to do is visit our website, which is www.sosflorida.com.
Right.
And there's information on our program there. You can make a donation straight through the website, and there are other ways that people can get involved so they can learn
what
about
about
all
the
of that.
multiple people out there that, and I have a lot of people that I would call mature,
Okay.
that might not have a computer in their house, so it must be a telephone number that they can reach you, right?
Absolutely, 954-420-5030.
There, I did what I wanted to do. I'm not usually don't do it, but I just did it. So, Sarah, tell us about your journey here. I know that you work for the Memorial System now.
Yes.
And you told me you were a school teacher for a while.
I was.
In the Broward County School System?
In Broward County School Systems, yes.
Where did you teach?
I taught at several schools throughout the county,
I see.
but yes, Broward County Schools. I actually got my undergrad here at Nova, Southeastern University in education, and man, there's Jamie Manberg. He was the dean of education.
Right.
So when I was attending, and he was one of my biggest mentor and cheerleaders at that time in my life of obtaining that degree, because I tell people all the time, I said undergrad is the rigorous degree, because they really want to know if you really want this. And I think NSU does a very great job at preparing us for the real world through our classes and the courses that we take and the professors that they place in the classroom. So I was ready for education once I graduated with that the bachelor's, and then I came back for the MBA. It was a great, I can remember calling Jillian when I was trying to decide what school, UM or Nova, UM or Nova. And then once we looked at the loans and everything, and knowing that I'll get a great discount coming back as an alumni, I was like, well, Nova it is. But yeah, so Nova definitely was a school that really prepared me, and I feel as though that the community has to understand that we are kids in foster care, and we're right here. I didn't go anywhere. I didn't leave. I didn't escape my childhood, my journey. I decided to stay here, develop a support system that I knew that would support me no matter what, and just be successful. And so I was able to do all that.
You know, I want to get to just turn it a bit. And I know that we used to have a very vital runaway shelter system in the state of Florida. Unfortunately, the governmental involvement made decisions not to continue to fund some of that, but it's been picked up by a number of different units. For example, I know that Lutheran Family Services picked up a lot of them, and picked up the one right here in Broward County. Do you get a lot of referrals from runaway shelters? Or?
No.
No.
Actually, all of our referrals come through ChildNet. So they
ChildNet.
Yeah. And most of our kids are coming right out of their homes. So the state goes in, BSO, on behalf of the state,
Right.
goes in and does an investigation to see what's going on with the children. And when it's really unsafe, they immediately take them out. And those
Right.
are the kids that we're getting.
And I would assume that that doesn't go all the way down to the infants that are involved with the child protection units.
We do get infants, particularly when it's a sibling group, because again, the idea is to keep the siblings
Right.
together. So we do have infants. Right now, our youngest is 2 years old, but we've taken in babies as young as 6 months.
All right, because I think that that's really an important thing for our viewers to know, because we all know that families that are able to live together, fight together, overcome together are stronger. Is that right, Sarah?
That is right. Unfortunately, I did not, I was not placed at SOS with my sibling,
Right.
but SOS did make it their business to make sure that my sibling and I, we had direct contact with each other. We had visitations with each other whenever we wanted to see each other and so forth. And SOS is uniquely designed where even if you are put in a home within that cul-de-sac with a sibling group, you're not excluded from not being part of that sibling. So the house that I grew up in, I was fortunate enough to be with four sisters, and we were sisters. Until this day, we still keep in contact with each other. We talk to each other. Several of them have moved out of state of Florida. They're in another state, and we talk and we just connect with each other. So SOS still, the concept of family and family-oriented activities took place a lot at SOS. We sat down together and had dinner. Holidays, we opened up Christmas gifts together. We even had other individuals who believed in Hanukkah. We did Hanukkah activities. So whatever it was that our heart desired, SOS made sure we were provided with those services and the activities of what we wanted. So
well, that's great. That's great. I say to the folks, we normally have shows that we talk about, cardiac disease, diabetes, orthopedics, things of that nature. But twice a year I try to do shows that talk about the healthcare of the community. And I think what is more important than dealing with the ability for us to invest our time and efforts in the children of our community.
That's right.
Who are really, we all hear from all the narratives that come over on television and about children are the future of our nation. Well, you were a child.
I was a child.
And you are now the future of our nation. So
Yes.
I feel every once in a while that we need to have a couple of shows that I dedicate to the healthcare of the community. And I think that this is a really wonderful opportunity to express my feelings to you that you are a blessed advocate, and I think that the people out there feel the same way. And I think that the time that and the efforts that are placed into creating the types of whole people like Sarah Thomas is something which is of tremendous value to the community.
Thank you.
Thank you.
Tell me one more time, SOS is in Coconut Creek.
Coconut Creek, 954-420-5030.
You're right on target. All right.
And get involved. I tell everyone, just get involved. There's a kid out there that needs someone. They may not be screaming on the outside, but on the inside, they are screaming for someone to support them and help them. And my scream was heard through Jillian, Mark Solomon, Barbara Zimmerman, and all of the SOS staffs that was taking care of me when I was in the foster care system. And then being able to sit on ChildNet board, I was able to really scream there to say, no, this is what we need to do. We're going to Tallahassee and we're going to make some changes, because we need people to understand kids in foster care They didn't ask to be placed there, but our responsibility as community citizens, as adults, as individuals, is to make sure they understand that this is not the end, and you
Okay.
can overcome it.
Well, again, let us know here at Nova Southeastern University what we could do to help you help others. And
Awesome.
we're willing to step forward. I just want to let you know that Dr. Hinbury always talks about, our president, always talks about our community responsibilities.
That's right.
And community involvement. Mhm. And, you know, he always talks about integrity, which you know about. And I just want you to know, again, folks, that we're presenting this show to make you understand that there is a natural need for our community in general, because these young people, otherwise known as children, need us to support them. It isn't a matter of just taking them to a doctor to take care of a scratch or a fever or otherwise. They need us to help them help us back to create a whole community of loving kindness and care. Thank you very much, Jillian Smath. You're a master's social worker, and you're the executive director of SOS Children's Villages here in Coconut Creek. And Sarah Thomas, how proud we are of you.
Thank you.
Not because you're a graduate of Nova Southeastern, but because you're a graduate from childhood to adulthood to trying to help others. And we thank you.
Thank you.
For helping them. So thank you very much for being here. Folks, I hope that we gave you something to think about. And I know that, like I said, this is not the typical show, but I think it was of value for us to present it to you. Remember, as I always tell you, this is your show, so you got to tell us what you want to know about. If you have any questions or you have any need for answers, there's a telephone number and an email address right here. And remember, this show is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see ya.